Before we had the lean operation, we've had 25 plus cardiologists in the center and a practice this big that sees 40,000 plus patients. It is difficult to have a system in place where they get their testing on time, they're not lost in the shuffle, and they're also seen by the physician on time as well.
So we have applied lean in healthcare in a cardio clinic and in an imaging center. In the cardio clinic, we were able to help the team by mapping the process to find out the redundant work. For an example, the same patient file was touched at least 5-6 times by 3 or 4 different people. So they were able to analyze the process, they were able to map the process. The same process now is done in one touch. And also they were able to reduce their lead time by around 20%.
So I think a system like lean, we have been able to cut back on the time for the testing, for the wait periods between the testings, and as far as I'm concerned, I get to see the patients once all the investigations are done on time. So it has cut back my time as well. I've had a lot of feedback from the patients that say because of this process, they're not just waiting around for a long period of time. So they get their tests done on time and they get to see me on time. So it's worked pretty well.
Those are huge type of improvements that can only happen when the senior management of organization as well as the staff embrace the concept of doing continuous day-to-day improvements in their operation. And over time, those little small changes and improvements that they do in their daily activities lead to big improvements and overall better value to their patients.
We have also incorporated KPIs, so key performance indicators, in evaluating our progress, and found that the patient time in clinic waiting for the physician has plummeted dramatically from over 2 hours to under an hour over the last 3 to 4 months.
Lean has helped us a lot is in recognizing where we've been wasting the value of the employees and help us be more efficient in the whole process.
At the end of the day, physicians were a lot happier. They no longer had to either wait for the patients to arrive. They're no longer behind by an hour or 2 at the end of their clinic. They're right on time. When I finish a clinic now, all of my work is done. The tests are all reported, the letters are all sent to the referring physicians, and effectively I walk out of the clinic the same time as my last patient is walking out of the clinic.
We all have inefficiencies in our processes, and looking at those inefficiencies is a good way to improving services and increasing your satisfaction of your customer.